welcome back to my YouTube channel once again. So today I'm going to discuss about the oral submucous fibrosis, that is OSMF, which is the most important condition in the entire dentistry. So I'm going to discuss in detail about the oral mucous fibrosis, about the definition, classifications, histology, clinical features, how it look like, how to examine, investigations, and management of the oral submucous fibrosis. Okay, so here is the most important condition. Okay, here you can see in this picture how the OSMF look like. Okay, this is the clinical picture. Okay, so coming to the definition, what is oral submucous fibrosis? It's nothing but the chronic induced progressive potentially malignant disorder. Okay, potentially malignant disorder of oral cavity. Okay, characterized by just a epithelium inflammation and progressive fibrosis of the lamina propria and deeper tissues, leading to the trismus, burning sensations and stiffness of the oral mucosa. Okay, this is the chronic induced progressively potentially malignant disorder. Okay, so characterized by the justa epithelium inflammation. Mainly here the justa epithelium will get inflamed. Okay, so here the mainly what you can see is the burning sensation of the mouth, then trismus, very difficult to open the mouth. Okay, because of the oral cavity, it becomes so stiff and so hard that the patient mouth opening is restricted. Okay, it gets so stiff of the oral mucosa. Okay, so this is the definition of OSMF. Okay, so this is how the clinically it look like. You can see the thick band you can see here in the oral cavity. It becomes so, it should be soft usually, but for this condition, for this type of patient, it becomes so hard that they are uh, very much painful to open their mouth. Okay, and there will be a burning sensation as well. Okay, so see the mouth opening in this picture, you can see mouth opening has been little bit restricted. Okay, so what is the etiology, what are the causes for this OSMF is areca are the major cause. Okay, here alkaline and flaminase, there are two type of enzymes which causes this OSMF. Okay, so those who eat smokeless tobaccos are the more prone to this cause. Okay, so this is how the arachnids look like. Okay, and chewing tobacco is also one of the most uh, common cause of this. So then the chili consumption, like those who eat so much of spicy food, will also be the major cause. Okay, then nutrition deficiency, vitamin B complex deficiency also will lead to this cause. Okay, this is how the smokeless tobacco look, betel, panpara, kaini, this all are the causative agents of the OSMF. Okay, so sometimes the genetic factors also influence, sometimes the family history, immunological factors also will cause this OSMF. Okay, so how the pathogeny or what are the mechanism of OSMF is chronic irritation from arachnids. Okay, there will be a chronic irritation. Okay, the causes epithelium injury, the epithelium of the layer will get injured. Okay, release of inflammatory mediators, juxta epithelium get inflamed. Okay, so here the increased fibroblast proliferation, increased collagen production. Here collagen production also get so much increase that causes the thickness, hardness of the cavity, oral cavity. Okay, so lysine oxidase also get increased, collagen crossover link will get increased. Okay, how rigid of mucosa is also there. Okay, reduced vascularity. Okay, this causes the epithelium atrophy. Okay, increased risk of epithelium dysplasia and carcinoma transfer. Okay, this causes the increased risk of epithelial dysplasia. Okay, and what happened here, the carcinoma transformation is also can also occur here. Okay, so next, how clinically it look like. Okay, so main symptoms are burning sensation, especially when they eat spicy food, it get whole mouth get burning sensation. Okay, so mouth opening is restricted, saliva secretion is reduced, so patients usually have dry mouth. Okay, difficulty in eating because they are unable to open the mouth to eat, also to swallow, also even for the talking also they feel so difficult to talk because the pain will occur. Okay, so recurrent ulcers will, you can see so much of ulcers being formed in the oral cavity. Okay, altered taste, they can't take the taste properly also. Okay, this is how the oral submucous fibrosis look like. Okay, so here you can see the ulcers also forming, recurrent ulcers you can see. Okay, Here also you can see ulcers, then so much like mouth opening has been restricted usually, and the hardness of the cheek, okay, mainly hardness you can see here, okay. So signs what are blenching of the oral mucosa, presence of fibrous band, especially in the buccal mucosa, retromolar area, soft tissue, soft palate, okay, stiffness of the mucosa, reduced tongue mobility, they can't move the tongue, there are atropic uvula because bud shape, it will cause uvula also. You can see here in the third diagram, you can see it will be in the bud stage, okay, like it will become bud shaped, okay. So these are the main this thing. More importantly, they are unable to open the mouth, okay. So this is how it look like, okay. Here also you can see the uvula, okay, and the areas where buccal mucosa you can see, retromolar pad you can see is blenching of oral mucosa, fibers, presence of fibrous band, here you can see, okay. So this is how the mouth opening get restricted, very difficult to open this much also, okay. Then histopathologically, how histologically it look like, okay. This is how the it look like in the microscope, okay. So this is how microscopic features, okay. This diagram you should draw, okay, for 5 mark of oral mucosa fibrosis. For 5 mark you have to draw this diagram, okay. You can see hypoorthokeratinized atropic stratified epithelium, then juxtaepithelium hyalinization, you can see the blends of collagen fibers, you can see blood vessels with prevascular inflammation, cell infiltrations, you can see, okay. Next, this is also the same diagram, you can draw the same, okay. So first in histology, what we will see, early stage initiation or inflammatory phase, how it starts, okay. What are the in epithelium, what are the changes, okay. Epithelium will be normal in the early stage, hyperplastic or atropic, it will be hyperplastic or atropic, okay. So what you can see is increased melanin deposition in the basal cells, okay. Reti ridges may appear elongated or normal. Here reti ridges will be elongated, okay. So next, connective tissue, what are just epithelial inflammatory reaction is the hallmark, okay. This is the main. In connective tissue you can see just epithelium inflammatory reactions, okay. Dilatation of the blood vessels with edema, then you can see lymphocytes, then plasma cells you can see, occlusion, neutrophils you can see, okay. These are the most things you can see in the connective tissue. Epithelium we saw, now in connective tissue, now in fibroblast and collagen, active fibroblast you can see, early deposition of fine loose collagen fibers you can see here in the fibroblast and collagen, okay. Muscle changes, what will be the muscle changes you can see in the histology is minimal or no muscle involvement in the early stage, okay. So next stage is intermediate stage, where fibroelastic stage, which is also called fibroelastic stage, okay. What you can see here in microscopic is in epithelium, atropic epithelium you can see, flattening or disappearing appearance of reti ridges you can see here, okay. So this is about the epithelium changes. Now connective tissue changes, what you can see is collagen become thicker and denser, mainly collagen is getting thicker and denser in the second stage. Then reduced vascularity has been reduced, and mild to moderate inflammatory infiltrations you can see in the connective tissue, okay. Then fibroblast, what you can see is active to inactive fibroblast, okay. Decreased cellularity in connective tissue, cellularity is decreased in connective tissue, okay. What are the muscle changes you can see? Early degeneration of muscle fibers, okay. You can see early degeneration of muscle fibers, okay. So next stage is advanced stage, okay, critical stage of fibroblastic stage, okay. So epithelium, what you can see is marked atropic epithelium you can see, thin flat epithelium with loose reti ridges, okay. Where epithelium with loose reti ridges you can see, increased epithelium dysplasia may be seen, okay. So increased epithelium dysplasia, okay. Basal cell hyperplasia you can see, nuclear polymorphism you can see, loss of polarity you can see in the epithelial changes, okay, in advanced stage, okay. So next, in connective tissue, what you can see, thick densely packed collagen bundles you can see, then broad band of hyalinization collagen extending into the submucosa. Here the collagen fibers are extended into the submucosa, okay. So next is ischemia you can see, spare inflammatory infiltration or absent, maybe or may not be present. Okay, increased deposition of type 1 collagen. Okay, here the deposition of type 1 collagen get increased in the connective tissue. So what are the changes in the fibroblast in advanced stages? Very few fibroblast. Okay. So mark reduce in connective tissue cellularity. Here the connective tissue cellularity has been reduced. Okay, in muscle changes what you can see is several severe muscle degeneration. Okay, here muscle get degenerated. Okay, so fragmentation and atrophy of the muscle bundles, replacement of muscle fibers by dense fibrosis. Okay, these are the changes you can see in the advanced stage in muscle changes. Okay, so next, this much is about the histology of the oral submucous fibrosis. Now what are the special stains where you can stain and confirm is these are the stains you can check for the if OSMF is there or not. Okay, like mesothelioma highlighted collagens. Okay, these are the things which you have to know for special stains. Okay, what are the stains used to identify the things. Okay, so next is pathogenesis correlation, how histological features correlate with pathogenesis. Okay, arcanites, alkalides, flavonoids, as I told you, increase collagen synthesis, copper ions, regulate lysis oxidase, more cross-linking collagen. I have said you, hypoplasia due to reduced vascularity, epithelial atrophy you can see. Okay, next is I'll give you the brief summary about this histological changes. What are the histological changes you can see here? Like in summary, this is diagram you have to draw in the exam. This is the most important, you have to draw. Okay, so next is in inflammatory inflammation plus edema plus young collagen you can see. Okay, in short I have given this. Intermediate may what you can see is maturing collagen with reduced vascularity plus muscle degeneration you can see in intermediate stage. Now in advanced stage, dense hyalinized collagen plus ischemia plus severe muscle atrophy plus what you can see is epithelium atrophy or dysplasia you can see. Okay, so early stage, what are the things you can see is just a epithelium inflammation, edema, dilatation of the blood vessels, early fine collagen deposition. Okay, in early stage. In intermediate stage, what are the things you can see? Thick collagen fibers, decreased vascularity, reduced cellularity, each muscle degeneration you can see. Then in advanced stage, what you can see is dense hyalinized collagen, marked decrease in the vascularity, then severe muscle atrophy, then mesoepithelium dysplasia, atrophic epithelium you can see. This is the things you can see in the microscope. Okay, I have summarized this histology in a very short form. Okay, so that you can remember, and if you write this much also is more than enough. If you know this point as well, it is more than enough for you guys. Okay, so next classification, how it look like. Okay, stage 1 stomatitis or burning sensation you can see. Okay, stage 2 may what you can see is fibrosis and palpable bands you can see. Third may trismus, mouth opening is restricted. Fourth stage may OSMS with malignant changes you can see. This is according to Minberg and Sitar clinical staging. Okay, so how you will diagnose is clinical examination is the most important thing. Here you can measurement of the mouth opening, you will check how much mouth opening you can see. Palpitation of fibrous band by the index finger, you will see the fibrous band how it is there. Then biopsy you have to take and confirm it is atrophic epithelial atrophy and fibrosis. Then you have to then imaging. Okay, MRI or fibroblastic changes you have to check. Okay, so now management, how complete control of the habit you have to check. Then medical therapies you have to give. Okay, these are the medical therapies you have to start with the management. Okay, then physiological therapies like mouth opening exercises, tongue mobility exercises you have to teach them. Then surgically, what you can do is this: the laser surgeries are there, coronoidectomy is there, buccal fat pad grafting is there, split thickness skin grafting is. These are the surgeries you can go for advanced cases. Okay, so complications, whatever complications you can see is, as I told you, trismus, speech and nutrition, difficulty in speech and eating. Okay, then xerostomia, dryness, which is dryness of the mouth. Psychological impact, it will be there. Definitely the psychological impact will be there. High risk of malignant transformation you can see, 7 to 13% it will get malignant. Okay, so basically what is the conclusion of this video is basically it is a thick band you can see in the OSMF. Okay, this is the diagram you have to draw for examination. Okay, OSMF is basically chronic progressive pre-malignant condition caused mainly by areca shaving, lead to fibrous trismus and epithelial atrophy. Early diagnosis, habit control, interlesion therapy, and physiotherapy are the key to prevent the malignant transformation. Okay, this is how the OSMF look like. I hope you like the video, and if you write this much also, it's more than enough for your examination. If you know in detail of this, is it is the most important condition, so learn it and examine the cases if you get properly, so that you will get the practical knowledge as well. And this is about the OSMF. This is for 10 mark. You can write full answer like this, so that you will get the proper good marks. Okay, and try to draw as many as diagrams. Okay, I hope you liked my video. Thank you for watching the video. Stay tuned for next videos. Do like, share and comment my channel. Thank you.